Individual patients respond very differently to chemotherapy, but a common complaint is lack of appetite, taste changes, nausea, sensitivity to spice or temperature. And so in order for a patient undergoing chemotherapy to meet their nutritional needs consistently and maintain their weight, maintain their strength and functional status, it's important to address each one of those issues. With taste changes, often even if there's, eating a piece of bread tastes like cardboard, there's often a flavor at least that remains consistent and continues to taste like you expect it to taste. If, say, a patient still tastes sweet, then you want to cater all of the foods towards that flavor so that they enjoy their meals more. So, for example, you could marinate a piece of chicken in jam or jelly or something fruity to enhance the sweetness of it, even though it's a protein that's not typically very sweet. A fruit-flavored yogurt or fruity popsicles to stay hydrated, or ice cream. Just taking anything that a person would normally eat and making it a little sweet. Protein is something that can be very hard to take in enough of during chemotherapy, again, because patients usually aren't in the mood for something heavy or for a traditional meal. And so often we'll use protein supplements. Usually I like to recommend protein powders, something like whey protein isolate, because it allows for more variety than if you were to buy a box of the same bottle of something. People get tired of that. So if they get a protein powder, they can mix it one day with bananas and strawberries and the next day with greens, and one day they can mix it with water, and if they really have no room and they feel like anything else is too heavy, and the next day they can mix it with milk to get some extra nutrients and calories and protein. So it allows for a lot more diversity, and especially with the whey protein isolate, you can get about 25 grams of protein per scoop, so it makes it a lot easier for us to meet that patient's nutritional needs. And as long as they're doing that, then the meals that they're eating, there's not as much pressure to consume a balanced meal.